So welcome my dear friends in this YouTube live session in my live class. This is a live class on nephrology. We are discussing nephron hemodynamics. Nephron hemodynamics. If you have any doubts, you can ask me over the YouTube chat or my personal chat, or you may also ask uh, at the email address. All right, at the email address which is provided to you. So I will begin the session. All right. This is nephron hemodynamics. We'll be talking about nephron hemodynamics. Nextopia Medical Education is proud to announce live classes for students internationally. We are sharing this privately. All right. Shortly we'll be sharing this publicly also. So let us begin our discussion. Nephron hemodynamics. In my last class, I told you that there are four important functions of kidney. So imagine that this is the Bowman's cup and these are the tubules. Bowman's cup and the tubules. Here we have got, say suppose, the afferent renal arteriole, the glomerulus, the efferent renal arteriole. See, understanding nephron hemodynamics is central to the understanding of the entire renal system. All right, entire nephrology. If you want to understand, you should understand this. So imagine that this is a tubule, and we have got Bowman's cup, afferent renal arteriole, and efferent renal arteriole. All right. So this is afferent renal arteriole, and this is efferent renal arteriole, and here is the glomerulus. All right. This is the Bowman's cup. I'll highlight the Bowman's cup now. So this is the Bowman's cup. All right. So in the nephron hemodynamics, before starting this, I already told you that how is this going to influence your understanding of entire nephrology. So in my last class I told you that there are four important functions of kidney. The four important functions of kidney include: one is filtration, second is reabsorption, third is secretion, and fourth one is excretion, right? Fourth one is excretion. So having understood this, let us try to understand what happens if there is. All right. So where do you find filtration? Where do you find reabsorption? Where do you find secretion and excretion? Let us quickly try to make a simple, a simple line diagram and try to understand this. So here, if you see, filtration starts at the Bowman's cup. So this is filtration. All right. Imagine that these are the renal capillaries. All right, the vasa recta and other renal capillaries which are parallelly going, and we have got these are the renal venules which are parallelly attached to the tubules. All right. So these are renal capillaries. We'll discuss the hemodynamics with the help of this diagram, right? So filtration occurs at the Bowman's cup area. Next we have got reabsorption here. Reabsorption. So this is point number 2. That is 2 is reabsorption. Next comes the point number 3, that is tubular secretion. Secretion into the tubules. This is point number 3. So 3 is tubular secretion. Secretion is nothing but few drugs, mostly many drugs actually, not few. Many drugs are secreted into the tubules like this, and this is how excretion will occur later. So excretion occurs somewhere here. So point number 4, that is excretion. Your entire nephrology depends on understanding of the concept here. Got it? All right. So how is this influenced? So as you can see here, the tubular excretion, that is point number 4. Tubular excretion is nothing but it is the filtration, that is the amount of solute that is filtered minus filtration minus reabsorption along with the amount of solute that is secreted. So filtration is nothing but tubular excretion is nothing but the amount that is filtered minus the amount that is reabsorbed plus the amount of solute or substances that are secreted by the tubules. Here we develop, if you add on to this, here if you see that excretion rate, if you talk about excretion rate, here if you talk about the excretion rate is equal to filtration rate minus reabsorption rate plus rate of secretion. Got it? Please remember that filtration is driven by the Starling's forces. Filtration is driven by the Starling's forces. The ultrafiltrate that is formed in the Bowman's cup, the Bowman's space, the Bowman's capsule, it passes through the proximal convoluted tubule, the loop, the distal convoluted tubule, and then the collecting duct. Alright. While it is passing, it may get reabsorbed or some substances might get secreted into the tubule, and the final product is excreted out as urine. As in my last class I told you that the first amount of fluid that is secreted into the Bowman's cup, that is filtered, not secreted, I'm sorry, filtered into the Bowman's cup is resembling plasma. Later on, lot of changes occur actively and passively. Active in the sense, if ATP is utilized and if ion channels require ATP, some activity there results in modification of this plasma, and then finally the excreted product is the urine, which is passing through the collecting tubules and is excreted out. If you talk about the reabsorption, tubular reabsorption physiologically is very important phenomenon. That is point number 2 in this diagram. Alright, tubular reabsorption. Tubular reabsorption is a process in which the solutes along with the water are removed from the tubular fluid, and they are transported into the blood. They are transported into the renal capillaries, as you can see in the diagram. Alright. Next is reabsorption rate that we are talking about is nothing but the amount of fluid, the amount of solute in milligrams that is reabsorbed from the ultrafiltrate in 1 minute. So a rate is nothing but in milligrams per minute, milligrams of solute that is reabsorbed per minute. Similarly, we have secretion rate, tubular secretion. All right, the tubular secretion, again, many drugs, as I told you, are usually eliminated by tubular secretion. This point you will have to remember, in exams they can ask you. Many drugs are secreted through the tubular secretion. Again, the tubular secretion rate is nothing but the amount in milligrams. The amount in milligrams uh, that is secreted through a particular time, like minutes. All right, milligram per minute is the secretion rate. Here what happens, there is transfer of material from the peritubular capillaries into the tubules. All right, this is called as secretion. In detail we are talking about this. And then we have got excretion. Excretion, you all know that substances that are excreted out in the urine, and so the substances which are filtered out actually, and then secreted, and out of those secreted amount, whatever comes out as excreted solute, we are calling it as excretion, and the excretion rate is nothing but milligrams per minute. All right, that is more important, that is equally important for you. All right, next let us talk about renal hemodynamics per se. Now let us start our discussion on renal hemodynamics. In renal hemodynamics, we shall be discussing about the autoregulation, the nephron, autoregulation of the nephron. Please remember that as the blood flows across the kidneys, blood flowing through the kidney, uh, blood starts flowing. We are talking about autoregulation, renal autoregulation. Actually, this topic is also dealt in cardiovascular physiology, but dealing it here is making more sense so that we understand the topic in as a whole. So renal artery, blood from the renal artery, then the blood is passing into the arcuate arteries, which is the branch of renal artery. This is very important. All right, we are discussing blood flow through the kidney, throughout the kidney, from here to the afferent renal arteriole, next to the efferent renal arteriole, and in between we have got glomerulus. So we have got in between glomerulus, all right, then the efferent renal arteriole, then now the blood has to reach the vasa recta. Now the blood has to reach the vasa recta. All right, so from the peritubular capillaries, what is vasa recta? Yesterday I told you that the tuft of capillaries surrounding the loop of Henle, you call it vasa recta. So from the peritubular capillaries, the blood reaches the vasa recta. So here the tubular secretion reabsorption occurs, vasa recta, and then it reaches the renal venules. All right, renal venules. That is the arcuate vein, and then the renal vein, then the renal vein. All right, right. So here in the autoregulation, it's very important that there are two important reflexes. There are two important reflexes which help in nephron autoregulation. All right. Nephron autoregulation. There is an issue. There is a all right. There are two important. There are two important reflexes or responses which are carrying out the nephron autoregulation or renal hemodynamics. What are these? The two are, one is myogenic reflex. So nephron hemodynamics depend on two things. We've got myogenic response or myogenic reflex and tubuloglomerular feedback. Tubuloglomerular feedback. The myogenic responses is the nothing but the smooth muscle, the intrinsic smooth muscle that contracts when stretched. All right. This helps in or cerebral, that is the renal autoregulation. The second most important one, that is the tubuloglomerular feedback, is one which we should understand. Here what happens is as the mean arterial pressure increases, this leads to increase in renal blood flow and thus the GFR increases. You remember this one single statement, you will be able to solve many MCQs further. Whatever MCQs come, it comes on based on this statement. I repeat the statement. The statement is, whenever there is increase in the mean arterial pressure, whenever there is increase in the mean arterial pressure, there is simultaneously increase in the renal blood flow and increase in the GFR. This is what is the tubuloglomerular feedback, helping us to understand the bottom line. Alright, let us try to further understand this statement. What is the statement I told you which is very important here? I told you whenever there is increased mean arterial pressure, if the mean arterial pressure increases, this results in increase in renal blood flow as well as increase in GFR. Increase in GFR. You have to remember this statement. It's a golden statement. All right, golden statement today. All right. Yes. Are you able to follow? Yes. You can communicate me in the chat. No problem. We'll discuss this further if you want me to explain with examples. So what happens is, whenever there is high delivery of sodium to the high delivery of sodium ions to the macula densa. What is macula densa? It is that part of nephron where the thick ascending limb of loop of Henle connects with the beginning of the distal tubule. This area is macula densa. So I repeat, what is macula densa? Macula densa is the area of thick ascending limb of loop of Henle, the thick ascending limb of loop of Henle joining the distal convoluted tubule. In this area we have got macula densa. So in area of macula densa, which senses the area of macula densa which senses the sodium, that is sodium ions which are delivered here, sodium ions which reach to the macula densa here. Now these sodium ions are actually responsible for, as there is high delivery of sodium ion, it results in activation of adenosine ATPase secretion, and this results in vasoconstriction of the afferent renal arteriole. So macula densa with high, if there is high delivery of sodium ions, this results in activation of ATPase activity, adenosine secretion. This results in vasoconstriction of the afferent renal arteriole. What will happen if vasoconstriction of afferent renal arteriole occurs? If afferent renal arteriole vasoconstriction occurs, so afferent renal arteriole vasoconstriction, this afferent renal arteriole vasoconstriction results in decrease in the renal blood flow and hence decrease in GFR. Did you understand this? So whenever there is vasoconstriction of the afferent renal arteriole, which commonly happens with hypertension. In hypertension also, this is the phenomenon that is seen. Alright, exactly opposite phenomenon is seen in renal artery stenosis. I'll talk about it later on. So here, whenever there is increased delivery of sodium to the macula densa, what is macula densa? I told you, macula densa is that part of nephron which wherein the thick, suppose this is the Bowman's cup, and this is the proximal convoluted tubule, and here we have got the loop of Henle, and then we have got the distal convoluted tubule and the collecting duct. So loop of Henle is divided into thin limb and thick limb, the thick ascending limb of loop of Henle. So here somewhere is the thick ascending limb of loop of Henle. This area, that is the thick ascending limb of loop of Henle and the distal tubule. So the area of union of this thick, the area of union of the thick ascending limb of loop of Henle and the distal convoluted tubule, this area, it is macula densa which is sensing here the delivery of sodium ions. If high amount of sodium ions are delivered here, it results in vasoconstriction, it results in fall in the renal blood flow and fall in GFR. Exactly opposite happens if there is decreased sodium ions. Whenever there is decreased delivery of sodium ions to the macula densa, what happens? The macula densa dilates the arteriole. When macula densa dilates the arteriole, there is increased renal blood flow and increased GFR. Alright, exactly opposite happens with decreased amount of sodium ions, right? Now we'll try to understand what is series hemodynamics and parallel hemodynamics. For this is slightly difficult to understand, so please remember that an individual nephron, if you talk about individual nephron that make up both the kidneys, the individual nephron are actually connected by parallel. But if you talk about one single nephron that represents two arterioles and two capillary beds. So the flow across the one single nephron is actually from one single nephron to the other single nephron is actually connected in series. Alright, if you compare the two different nephrons in both the kidneys simultaneously, if you consider, they are parallel to each other. But two nephrons in the same kidney, suppose they are connected by two capillaries and two venules and all, they are actually connected in series. Now in series, what should be the flow across the system? In series, the flow across the system should be equal in all the points, is it not? So what is flow? Flow is nothing but pressure over resistance. That is the pressure gradient that is seen across the series of connection of nephron. When taken over resistance,